Hello, my name is Michael Lees. I'm just going to be talking real quick to y'all about medicine/drug-induced anxiety. Now, first and foremost, some of the symptoms. It's associated with panic attacks and with anxiety, and if you don't know what those symptoms are, it usually falls in the lens of racing heart rate, sweaty palms, racing thoughts, all those fun little things, you know? Now, some of the diagnostic criteria, there has to be proof of two things. First of all, that the introduction of a substance, whether that's intoxication, withdrawal, or just any exposure, is linked to the symptoms of anxiety or the panic attacks showing up around a similar time. So you start doing a drug, anxiety, boom, there you go. You stop doing a drug, boom, anxiety, there you go. Or grandma starts smoking, you get it in your lungs, anxiety, boom, there you go, another one. But the substance, the second part of this, is that the substance also has to cause the symptoms that you're experiencing. For example, Ritalin, used to treat ADHD, it has a side effect of anxiety potentially, so that is one of the potential options. The diagnosis cannot be better explained by a different type of anxiety. So if there is, I don't know, social anxiety prevalent and you only use medicine or the drug in social situations, then perhaps the medicine/drug-induced anxiety is not the best explanation. This also can't happen during a state of delirium, and that's just an altered state of consciousness, and you might experience confusion, nausea, all that kind of stuff. Now, I'm going to give just some quick examples of how this might present itself in the real world. Let's take Tommy, for example. Good old Tommy. Let's give Tommy the age of 7. Good old 7-year-old Tommy. Can't pay attention in school. Why not? I don't know. So his parents take him into the doctor. Boom, he's got ADHD. Oof. The doctor starts to prescribe him with Ritalin. Suddenly, when he starts taking it, he's like, my hands are getting sweaty. My mind is racing. This is like the opposite of what I should do. I'm starting to freak out a little bit. And his parents start to notice this. It turns out that good old Tommy, that's his name, has medical/drug-induced anxiety. Now, another example, because that was an example of a drug being introduced and anxiety being present immediately after it being used. Let's take another example. Little Jenny, 10 years old. She lives in not the greatest household. They're right above the poverty line. You know, it's very, very every day is a bit of a worry. And she starts turning to alcohol to cope. She just sneaks into her fridge, grabs a bottle of her dad's vodka, sip, fill it with water, put it back, and she would drink every single night until it no longer had vodka in it. And upon it no longer having vodka, she suddenly started to experience these anxiety and panic attack symptoms, and her parents didn't really notice because they didn't really care. But these are both examples of it being introduced both with medicine in Tommy's case and with drugs in Jenny's case. As I said, it can present itself at the introduction of a drug, at the exit, withdrawal, or just exposure. Now, looking at the etiology, looking through our book, I figured that classical psychoanalytic theory would be the best option for the theories, because it views anxieties and phobias as defenses against unconscious conflicts rooted in the child's upbringing. So first and foremost, this has a prevalence rate of 0.003%, according to the DSM, and that means that it's not super common, which has led me to come to the conclusion that children are not being diagnosed with this super often. It's not a very common situation, but both of the situations involved the children having some sort of stressor. For example, for Tommy, it was ADHD. He was starting new meds. his body was unfamiliar with it. And so his response to it, his body's response was an anxiety response, as there was fear of what was going into his body. And then in good old Jenny's case, she'd been raised in a high-stress household, right above the poverty line, very high stress, and those are all risk factors. That's about it. Thank you. Sorry I'm not in class. Woo!